dental care in western Kenya was virtually unattainable until recently. For the people that live in the region of Mount Elgon, their only access to dentistry was along this sometimes impassable road. It required a 1.5-hour drive to Kitale to reach one of the 2 dentists serving 200,000 people in the region. In November 2008, a group of dentists through the Tabasamu organization in New York City began a project to work together with Dr. Bea Andersen of Mount Elgon Flower Farm to change all of that.
Few people in Africa have been able to achieve what Dr. Andersen has been able to do for the people of her community. She is raising the standards of health and education for her community using a sustainable design. Her local, homegrown projects include a fully staffed medical clinic serving 25,000 patients each year, a brand new primary school which enrolls 660 children, a secondary school, an orphanage, an AIDS testing and treatment center, an orthopedic center, and many scholarships for continuing medical education. Incredibly, all are being developed and funded using flower farm profits and small donations from a foundation in Holland.
Along with her husband Bob, who operates the flower farm, Dr. Bea has developed a full healthcare system and a housing and community development model that is rare in this part of the world. On a recent visit by Dr. Paul Leventhal from Tabasamu, clinical materials and equipment were provided to give the Andersen Dental Clinic its first breath of life. It is now a fully equipped dental operatory. Now visiting dentists will be greeted with the latest in light-cured bonding methods, a new ultrasonic scaler, 2 Schick Technologies digital X-ray sensors, and a new Dell laptop. Through the efforts of Dr. Paul Leventhal, this equipment was shipped to the medical center, reassembled on site into a working dental clinic in a room provided by Dr. Andersen alongside her medical clinic. Tanya Richard, a dental hygienist from Tabasamu, has started a prevention program with staff trained to place resin sealants and to offer early diet modification and oral hygiene instruction for all students entering the primary school. With the training of the staff, these instructions can continue even after Tabasamu returns to the States. Without this education and good preventive practices, dental health will continue to suffer with a high decay rate, resulting in tooth loss and a life of painful teeth for these kids. Tabasamu's efforts in this preventive education has made a difference in the future of these children.
That you take time to come out here and teach them, and you've come with all this equipment, and they just can't believe it, that they are worth all that effort. And I think that gives hope to people.
Mm-hmm. Yeah. So Tabasamu could help in that way as well?
Personally, I think investing in educating people, whether it is on the job training and give them skills, or whether it is to support them as a sponsor to do a training, is one of the best things of developing Africa. And usually those people who have been given that opportunity within their community will come back and will be very strong ambassadors within that community. First of all, they've learned about a profession that they barely knew about. They only knew the name. They didn't even know what it comprised of. They know that now. You've opened their minds. They've had a wonderful week. You've seen the change in them from the first day. I think it's the hope that you give people. That's the most important thing. I was saying, if Tabasamu really wanted to make a difference in the long run for dental care in Kenya, they could consider sponsoring students to become co-hosts or even dentists, because from this community there would be no children who would ever be able to afford to do those trainings. If they are very bright students and they are straight A's, then they go onto a government-sponsored place in university. A coho, I think you're looking at $1,000 a year. And within my medical program, we always have 1 or 2 people on training.
So you're training somebody now in medicine?
At the moment, one person is becoming a doctor, one is becoming a physiotherapist, and will come back and work for us for our disabled program. We've just upgraded the lab technician, who is now a lab technologist. We all the time do training and upgrades on HIV/AIDS. And then next year we're going to build a vocational training center. So that would be a place where we could train oral hygiene.
Right.
That could be one of the courses that we offer. Oh, I forgot one thing. We also have an orphanage.
Right.
At the moment with 17 children. In January we'll build the new orphanage next to the hospital, and then we'll go up to maximum 32.
And that's, I assume, kids that have lost their parents due to AIDS.
Both, yeah, those children have lost both parents to AIDS, and they have been selected by the communities to be taken up in our orphanage.
It's a lot of stuff going on.
Yeah, but it didn't all happen overnight.